If anybody else was doing this, they would be cheering it. But because they've been propagandized, mind controlled into hating RFK, they can't bring themselves to cheer this on. RFK getting it done on the vaccines. He announced the repeal of a policy that rewarded hospitals for reporting staff vaccination rates. So if you got your staff, if a certain percentage of them were reported as vaccinated, then they got money. They got money from the government. And people are upset about this. So now he took away that incentive. And why are people going to get now? If you have to give people a financial incentive to get vaccinated, what is especially medical professionals? What does that tell you? If you have to give them and if you take away that financial incentive, nobody's going to get vaccinated ever again. Right? That's what I'm to conclude, right? I mean, according to my friends in Hollywood who don't know anything, that would be a disaster for all the Americans who go unvaccinated into the future. Then Earth's going to be filled with people, and then what are we going to do? Travel to other planets? I mean, come on. You got to get people vaccinated. And let's just remember this, that the last year's flu vaccine, it had a negative efficacy, which meant if you got vaccinated for the flu, you were 27% more likely to get sick with the flu. So it sounds to me, I'm not a medical professional. Please don't take any advice from me. I'm just making an observation. It seems like the flu shot made you sicker. That's what it seems like. I don't know. I can't
negative efficacy, we would call it.
Yeah. This year's flu shot linked to higher flu risk. That's from the Cleveland Clinic. So let's just keep that. So that was so the premise. This was like a Biden era thing. We're going to pay you at your hospital if you get your staff vaccinated. That was the Biden rule, big idea, that the higher staff vaccination rate would lead to fewer healthcare workers getting sick. But that's not the case. The Cleveland Clinic study showed that's not the case. The more people who got the flu vaccine, the more people got flu. Isn't that something? Here we go.
I guess who's still getting a flu shot? You must be.
I think the ad for the flu shot should be, "Hey, you're a busy consumer, and let's be honest, you're too stupid to even listen to this entire commercial. You're just going to receive the instructions that you should go and get this shot, and you will do it because it shows someone smiling on TV while walking to get their shot." That's right. There'll be people who don't even look into it at all, and a lot of those people even get comedy specials.
Most of them.
But yeah, most of them.
I mean, you just make your own. You don't need to get one, but it's like a flu shot. You don't really need to get one.
So it is in his department's latest move. I like how they put that. In his latest move related to vaccine-related reform, HHS Secretary RFK Jr. announced more repeals of federal policy that rewarded hospitals for reporting staff vaccination rates. Kennedy said in a press release that the policy was coercive and denied informed consent.
Yeah, it's not going to the vaccinees, right? It's going to their supervisors who force them to do it.
Medical decisions should be made based on one thing, the well-being of the person, never on a financial bonus or a government mandate, Kennedy said. It makes all the sense in the world when you put it that way, right? Makes all the sense
for you.
Doctors deserve the freedom to use their training, follow the science, and speak the truth without fear of punishment, Kennedy said. This was created under the Biden administration's Center for Medicare and Medicaid Services inpatient payment rule. The policy linked hospital reimbursement to staff vaccination reporting. It sounds to me like the big pharma told the government to give a financial incentive to medical facilities to get their staffs vaccinated because big pharma makes more money off that. And that's not how you're supposed to do medicine. Have a financial incentive for people to take a medical treatment. That sounds very Nazi-like. I'm just saying it sounds that way. I'm not saying it is. It's saying it sounds that way. And it's also a handy way to keep whistleblowers quiet, if you think about it, just to keep their job. Whether nursing staff, doctors, or anybody else in the payroll chain, just shut up because we're getting a lot of money for these vaccines. Doctors and other providers should have the same autonomy to choose what's right for their own individual healthcare needs as the patients for whom they care. I like that he knew how to use whom. I never know when to say for whom or for who they care. Whom. Today's announcement helps, it's like when you answer the phone, to whom am I speaking? Today's announcement helps put that power back in their hands. That's what Dr. Oz said. The move represents the most recent policy repeal under CMS. Well, that's nice. These moves are part of a broader effort to restore medical autonomy in federally funded programs and root out financial and regulatory pressures that incentivize physicians toward prescriptive medical decisions rather than individualized evidence-based care. So again, this is the bright spot in the Trump administration is HHS under RFK Jr. There's no one has ever done anything close to this in my lifetime at HHS. HHS has been a completely captured regulatory agency by big pharma and big insurance. So the fact that it's going the other way, a lot of people are upset that Bobby and it's not going fast enough, but it's finally, for the first time in my life, going in the right direction. And a lot of people hate RFK because of his Zionist stance on Israel. I find it that completely abhorrent, his stance on Israel, as all Zionists, but that'd be just about everybody in our government except for maybe a handful of people.
I find it to be as forced as Kash Patel having to get a Mossad beard to hide his gayness.
So yeah, and I totally disagree, and I find it stomach churning. They're a Zionist position, including RFK's, but that doesn't mean I'm not going to work with them somewhere else. It's like Frederick Douglass said, I would work with anybody to do right and with nobody to do wrong. So if somebody's going to come in and clean up the medical system in the United States or attempt to get poison out of our food, have safety testing for vaccines, follow the science instead of follow the money, for the first time in my life, I'm gonna cheer that on. And you're a sucker if you don't, because that's what they want. They want you to hate someone and then write off anything good they do in government. That's not how politics works. Politics, it doesn't matter how the sausage made. The only thing that matters is the eventual outcome. And if you want to have some good eventual outcomes around our health policy in the United States, you should cheer this on. I don't care who's doing it. If he's doing it or Newt Gingrich is doing it, I don't care what bad person you put in charge. If they're going to do something good, I'm going to cheer it on. He has implemented multiple changes regarding vaccines. The FDA in late May said it planned to limit access to future COVID vaccines to people 65 and older and individuals with underlying health conditions. The agency also announced they would permit vaccine manufacturers to coordinate in-depth studies to assess the efficacy and safety of COVID vaccines in children and younger healthy adults. So he's got to do that. So they got to have these studies. So when he bans them altogether, they've banned them pretty much. But when he drops the final hammer, he's got it, because he's going up against the most powerful people in the world, Big Pharma. He's going up against the people who are bought off by Big Pharma, which would be the Pediatrics Association of the United States. Yeah, they're bought off. Most of the medical boards, most of the medical journals, they're all bought off. They're all bought off by Big Pharma.
For a long time now.
For a long time. And
little by little they did it.
Yeah, so a lot of people are like, well, he still hasn't revoked that. Yeah, he's got to do it methodically. So when he finally does it, it's going to stick. That's why he has to, and he's got to get the data and he's got to get these studies done. He can't just come in and say, hey, so that's my position on it anyway. In recent months, HHS has also dismissed all 17 members of the Centers for Disease Control and Prevention Vaccine Advisory Panel. They ended the CDC's COVID-19 vaccine recommendations for pregnant women and healthy children and ordered the removal of mercury from influenza vaccines. These are all big, huge deals. After it voted to advise officials to stop recommending the influenza shots that have mercury, the remade Advisory Committee on Immunization Practices, called ACIP, ACIP, said it plans to look at multiple other vaccines. Isn't that nice? They just take the fun out of everything. What have you left of it? Can I still put MSG in my food? Is the allergy police going to throw a bag over me and load me into a gluten sensitivity truck? Dr. Tina Tan, which is one of my favorite doctor names. Dr. Tina Tan. President of the Infectious Disease Society of America. So she's also bought off, I'm going to guess. This is my guess. She said that re-examining the childhood vaccine schedule and the use of thimerosal are both politically motivated actions that are not based on science. So she's completely a liar, Dr. Tina Tan.
Fauci is the science. So did he
Dr. Fauci is the science, as we know, Tony Science. And so Dr. Tina Tan, although having a great name, she's Dr. Tina Corrupt. Because why do you think they took thimerosal out of all the other... Almost every flu vaccine didn't have it already. Why do you think they did that? They weren't following the science when they did that?
They used to say it was out of all of them for many years, and you were silly to even bring it up.
Yeah, and so, right? They used to say that. So raising questions without adequate data casts doubts on vaccination. Yeah, that's why he's going to do the studies now. The studies that they never did. That's why RFK is going to try and do the studies to have a placebo-controlled study for vaccines, which they've never done.
You think they would have.
You think they would have. So she's saying you can't, well, until you do those tests, you can't raise doubts, which can further drive down confidence in vaccines. So this is she's just a PR spokesperson for Big Pharma. More than any other medications, vaccines are extensively and constantly reviewed and evaluated. So why are you upset that he's doing that? So she's contradicting herself in her own paragraph. She's like, why are you making people hesitant about vaccines? Huh. We all by wanting them to be studied. We constantly study them and review them and evaluate. So that's what he's doing. So that's what he's doing now. He's extensively and constantly reviewing and evaluating them. That's what you say you're already doing. Why are you upset he's still doing that?
I'm getting hesitant.
So, but it's not 100% true, though. It is based on science, but the science you would learn from a child's chemistry set after you filled them with mercury. Martin Kulldorff, who's been a guest on this show, he's the new chair of the ACIP. He explained that Kennedy had given the committee a clear mandate to use evidence-based medicine for making vaccine recommendations. And if you'd like to hear my take on vaccines, you come see me at Rutherford, New Jersey, and then at the Village Underground in Manhattan. Then after that, I'm going to be in Calgary, Vancouver, and Edmonton. Go to jimmydore.com for a link for tickets. Vaccines are not all good or are bad. If you think that all vaccines are safe and effective and want them all, or if you think that all vaccines are dangerous and don't want any of them, then you don't have much use for us. You already know what you want. But if you wish to know which vaccines are suitable for you and your children and at what ages, then we will provide you with evidence-based recommendations. So that's exactly what Bobby Kennedy's doing right now, and they're doing over at HHS and the CDC, is they're doing the tests so they can have real science, not science bought by Big Pharma.
Should I still stockpile fluoride tablets?
I think so.
Ingest?
The CDC notified some outside groups that they can no longer participate in panels that review vaccine data. So what are these outside groups, you think? What do you think of those groups are? Groups that are bought by Big Pharma. And one of them is, so the panels meet behind closed doors and typically include members of the ACIP, which advises the CDC on vaccines. So one of those groups was the American Academy of Pediatrics. So of course they're bought, just like all the other, they're corrupted by Big Pharma money, and they used to be able to sit on in those vaccine regulatory meetings, and now Bobby Kennedy's like, no, they don't get to be in there anymore. Hooray! These are all great things that people should be doing. If they weren't already propagandized by Big Pharma bought media, they would be cheering this on. But they have been fed this steady diet of hatred for RFK Jr., and so it's just like a reflex to them now. They don't know what else to say. They can't ever cheer on anything good he's doing. This is amazing. If anybody else was doing this, they would be cheering it. But because they've been propagandized, mind-controlled into hating RFK, they can't bring themselves to cheer this on. But in the words of Anna Kasparian, I am better than you. And I don't fall for that. And that's been the guiding light for this show is we are what they call heterodox. And we go against the establishment narrative. For instance, the American Pharmacists Association. Oh, wait. An official said some groups are being removed from the work groups because of concerns that they have conflicts of interest. For instance, the American Pharmacists Association lists vaccine manufacturers such as GlaxoSmithKline and Moderna among its corporate supporters. Really? Let's get them in the meeting. You know what? I thought pharmaceutical companies were using evidence-based research already. I mean, I guess I don't know, more like a crime scene evidence. It's getting harder and harder to come up with any other reason to explain what it looks like outright and attempt to kill us all off. But how about a whoopsie? Does that cover it? So let me make sure I read this right. The panels meet behind closed doors and typically include members of the ACIP, which advises the CDC on vaccines. The work groups also composed of experts from liaison organizations like the American Academy of Pediatrics. So he is saying, I'm not misreading that. That's one of the groups, right, that can no longer participate in panels is the American Academy of Pediatrics. Am I misreading that? So they say here that the CDC notified some outside groups that they can no longer participate in panels that review vaccine data. And then here it says the work groups are also composed of experts from liaison organizations like the. So is that one of them?
Sounds like it.
That's one of them, right?
Yeah, it sounds like it.
Okay. And then also the American Pharmacists Association. And then under the old ACIP, outside pressure to align with vaccine orthodoxy limited asking the hard questions. The old ACIP members were plagued by conflicts of interest, influence, and bias. We are fulfilling our promise to the American people to never again allow those conflicts to taint vaccine recommendation. Who said that? Andrew Nixon, a spokesperson for the Health and Human Services Department. Wow. And he then went on to say, except when it comes to mRNA, then let the taint and conflict begin. And if you're wondering where the taint and conflict is, it's just between some asshole and a dick. Come on, that's good. That's a good joke. Kurt's busy looking up something on his phone, but that was a good joke. Where's the taint? Come on.
What? They're shrinking, Jimmy. There's too much petroleum in the Fruit Loops.
So this is what they were afraid of him doing. And nobody else has ever done this in my lifetime. And he's doing it, and people can't bring themselves to applaud it or amplify it because they've been brainwashed with hatred for anything RFK Jr. does. All politicians are hugely flawed. It doesn't matter who's doing something good. If somebody's doing something good, you should join. It's just like when we had the anti-war rally and the Code Pink ladies wouldn't come because they didn't agree with the LGBTQ stance of some of the anti-war speakers. It's like, yeah, this isn't an LGBTQ rally. This is everybody coming together to stop a war, and that's what gives it power when people who disagree on a lot of other things can agree on this. And
what was the stance? Some trans bullshit, I bet.
It was that they didn't like. It was Jackson Hinkle and some other stuff. They didn't, and that's
let the war keep going on then until we get that sorted out.
And I remember there were some guys from the Revolutionary Blackout Network that were saying. Some gay guys that were saying, no, you have to engage those people. You show up, you engage the people who have anti-LGBTQ views, and you let them know you as a person, and that's how you change their views. You don't change their views by never talking to them. Anyway, so this is a long way of saying that if you have a show and you can't get behind this, there's something wrong with you. You've been propagandized and you've been brainwashed. And shame on you for not amplifying this and for cheering it on more. So we're trying to get big pharma money. That used to always be a left position. We want to get big pharma money out of our government, out of our captured regulatory agencies. That used to be a lefty position, and they completely flipped during COVID. Just
like Colbert's position, if I recall correctly.
That was Stephen Colbert's position when Trump was president, and then as soon as Biden became president, he completely flipped. That used to be everybody's position.
Yeah.
Until
he's an
COVID.
Intentional bad guy for that.
Yeah.
That's not like he's just like so like dumb, you know, like a view gal. That's like he's an on purpose piece of garbage.
Yeah. And then you saw my former piece of garbage friends attack me publicly for being skeptical of Big Pharma like they are supposed to be. And of course they're not, because they're dumb and they're Hollywood knuckleheads. They're empty heads. They don't know anything. And also many of them are jealous that my show took off and theirs didn't.
There's a lot of jealousies.
A lot of jealousies. Anyway, so good on RFK Jr. over at HHS. All right, be honest. Have you noticed yourself moving slower, avoiding stairs, feeling stiff in the morning? Not that kind of stiff. If so, pay attention. The truth is, mobility doesn't just vanish overnight. It's a slow decline. And before you know it, you're the guy making weird noises every time you get off the couch. But by the time you pay those grunts enough attention, it can feel too late, but it doesn't have to be. That's where Juvent comes in. This isn't some gimmick or magic pill. It's a clinically proven device that uses safe, low-impact micro vibrations to strengthen your bones, improve your circulation, and keep your joints working the way they're supposed to. Notice I said micro vibrations. This is nothing like those other shake plates on the market, which, by the way, can be extremely dangerous. I stand by my Juvent for just 20 minutes a day, and it's made a noticeable difference in how I feel. It's like giving your body a tune-up before it completely breaks down. Athletes, doctors, even NASA is using this thing, and if it's good enough for astronauts, it's good enough for a comedian. With a 10-year limited warranty, financing options, and the ability to use FSA funds, it's never been easier. So don't wait until your knees sound like a bowl of Rice Krispies. Get a Juvent today. Go to juvent.com/Dore and start moving like you're supposed to. That's JUVENT.com/Dore. Code DORE for $300 off at checkout. Your joints will thank you. Trust me. Come see us on tour in Rutherford, New Jersey, New York, Edmonton, Calgary, Vancouver, Appleton, Wisconsin, Rosemont, Chicago, Louisville, Kentucky, and Fort Wayne, Indiana. Go to jimmydore.com for a link for tickets.